state your name for the record. Try, and if you don't mind, Chad, or you, Doctor?
Dr. Evans, yes.
Doctor? That's right, I met you, but I apologize.
Yeah, that's fine.
You look kind of young to be a doctor, man.
It's the braces.
Try It's the braces, the quote of the day. If you can add to whatever you've heard already, add to it.
Yeah.
You know, try to keep it within those.
Sure, I'll try. So my name's Dr. Chad Evans. I've been practicing dentistry for 9 years. I worked with many of you last session to pass 1803, and thank you for allowing us to update you on how that's being implemented. I do want to quickly just address a couple of things, and I really appreciate your interest in this, Representative Fallon. I consider it a pretty important issue as well, especially when it pertains to fraud. I mean, I can categorically say that none of us are in favor of fraud, and all of us think that that should be dealt with in a very serious way. The fraud rates that were quoted earlier, and I heard that said is the fraud rate of 10 to 15% within Medicaid. I think it's real important to point out that fraud rate of 10 to 15% includes program violations. Okay, a program violation is a paperwork mistake. That's like you didn't write something down in the note that maybe should have been. As you know, Inspector General Wilson has pointed out, Texas implemented a new system called Torch, which is lauded as the most advanced fraud detection. That's what I've heard it explained. Fraud detection software that's out there. I was recently at a OIG educational event being put on by Dr. Altenhoff, who's been mentioned, and she pointed out that this new Torch system, which essentially looks into property ownership records, bank accounts. I mean, it looks into everything that us providers have. It's almost kind of like a mini NSA. And what they've discovered is about a 0.3% rate of suspected fraud. Okay, so per the numbers that she was reporting at this educational event of actual suspected fraud, it's a 0.3%. So a 99.7% okay.
What's her name?
Dr. Linda Altenhoff. And I have the PowerPoint presentation that she actually provided, and
she was brought to you all by the OIG's office.
Dr. Linda Altenhoff, she's the dental director at OIG.
Oh, she's a dental director.
Yeah, and this was
Is she here?
No, she's not.
You didn't bring her to this, man?
No, I didn't. I don't think she wanted to come. Okay.
Well, but apparently y'all need to communicate a little better, because if she's telling them that it's 0.3 or whatever, and you're telling us that it's 10%.
Yeah, that's in the industry. And keep in mind, Dr. Altenhoff speaking from Torch. Torch has not yet ingested all the Medicaid data that we have. We have a lot of MCO data that's not in Torch. So I'm not sure what they're seeing yet, and I'm not sure what percentage she was quoting, but I'll get to the bottom of that.
So, and I thought that was real interesting to point out. But again, the 10 to 15 includes paperwork mistakes. It's not just a 10 to 15% fraud rate. And I would say as well, if there was a 10 to 15% fraud rate within Medicaid, there'd be a major we'd have a major problem with medical and dental providers, just fundamentally. That would really be concerning. So, just to kind of give a little bit of comments. I just want to limit my comments to 3 topics that I believe should be addressed in a new OIG due process bill next session. One would be payment holds for program violations, a reliable pre-authorization process, and the use of extrapolation. So program violation, that's kind of a fancy term for things like paperwork mistakes. The OIG will use these as simple paperwork mistakes or program violations to justify a payment hold. Payment holds are devastating on a dental practice, as we've heard. Lives of patients and staff are severely interrupted. I literally personally had to lay off 117 individuals in a single weekend as a result of a payment hold for program violations. 170 gainfully employed Texans now on unemployment. I'll give you some examples of the problems surrounding payment holds for program violations. According to the Medicaid provider contract, I am required to provide the same offers and services to Medicaid patients as I am to the general public. A few years ago, in order to gain more clarity on this point, my compliance officer reached out to the Texas AG's office and was referred to published federal guidelines that provided guidance on allowable office promotions. But then Texas OIG put out a statement that made no allowances for any kind of promotion. This seemed to contradict both the feds and the AG's office, so I personally called HHSC to try and get to the bottom of it. Here's how that went. I called the OIG and spoke to the operator, who couldn't help me, but connected me to an OIG agent who also couldn't help me, who transferred me to a supervisor who didn't have a clue, who put me in touch with TMHP's policy department, who transferred me to another supervisor, and the supervisor at TMHP said, "What? I think you should speak to OIG." And this question that I was asking that everyone's having such a hard time with was, is it, based on this new OIG statement, is it okay for me to give my patients a toothbrush? I was just trying to get clarity on something as simple as that, and that's the kind of process that I went through. However, despite our best proactive efforts, our practice was cited for various program violations, including the one I had specifically asked the OIG about and placed on a payment hold. Another example, if you don't get informed consent for checkups, that's a program violation and gets you on a payment hold. Now, of course, now this isn't in the board rules and it isn't even in the Medicaid provider manual, but it will get you a payment hold. Another supposed paperwork mistake or program violations allegedly committed was recording in the patient file that oral hygiene instruction had been provided, but not writing down the angle of the toothbrush that you told the patient to hold that toothbrush at. I think it's important to understand a program violation is very different than an allegation of fraud. So I believe the penalty should be different. A payment hold is not proper for just making a technical error. After placing the payment hold, OIG then performed what is called an extrapolation. Once they identify an alleged paperwork mistake or program violation, they then allege that you made that same mistake thousands and thousands of times and extrapolate a penalty for that one mistake. In my case, they have extrapolated this one mistake, not what angle to hold the toothbrush at, into a $4 million penalty. As you can probably see, this is definitely not fraud, and I would contend it's not even an error. But that doesn't matter. The OIG uses this power to hold these sorts of claims over a provider's head and extrapolate anything they view as a mistake into millions of dollars in penalties. It's not thousands, it's not even hundreds of thousands, it's routinely millions. Finally, HHSC or its agent. So if HHSC or its agent pre-authorized a medical or dental service, many dentists submitted cases to ACS Xerox for pre-authorization, as we heard from Dr. Dunn. With all the required and requested documentation, this included a series of pictures, radiographs, tracings, and a score sheet. This material would then be reviewed by ACS Xerox and approved or denied. If approved, the provider is then legally obligated to provide that treatment. Despite these facts, OIG has prosecuted countless providers providing a service that was pre-approved by HHSC's agent, ACS Xerox. So, finally, in conclusion, I think the following improvements should be made to 1803. The OIG should only be allowed to use devastating sanctions such as payment hold for instances where fraud is evident, not for simple program violations. If the OIG, number two, if OIG is going to charge someone with a penalty, they should have to prove the material facts that form the basis of that penalty, not be allowed to extrapolate one error or mistake into millions of dollars. And lastly, pre-authorized procedures should not be eligible for sanctions or prosecution, assuming no new facts are uncovered. Thank you for your time. I really appreciate it. If you have any questions.
Dr. Zerwas?
Thank you, Mr. Chairman. Thank you, Dr. Evans. Tell me a little bit about the time from which you were aware that you had to surrender, I don't know how many records you had to surrender, to the point that you had 100% withhold for a period of time. Is that correct?
Yes.
And then a period of time went by and you had, like Dr. Dunn, a lesser amount of a withhold. Can you tell me a little bit about that time span, the process, and what information went into changing you from 100% withhold to whatever the balance was.
Sure. So in January of 2013, the investigation was initiated. About 4 or 5.
And how was that initiated? Tell me how that.
It was kind of like a sting operation. We had several practices, and all at once there were investigators in each one of the practices all at the same time. I think they coordinated it and all walked in at the same time and started demanding to be able to tour the facility and see everything and get records and get information. And so that was in January of 2013. We then had 3 days to provide about 200 medical or dental charts. That's actually a pretty big undertaking for those that don't know. We provided all that information, and another thing that we do in our practice is we have cameras throughout recording all activity that happens in all of our practices all the time. And so they wanted all of the recordings from all the practices from every camera. Each office has about 40 cameras in it. And it was literally terabytes and terabytes of data. We eventually decided to give them the hard drives because it was impossible to copy all of that information in 72 hours. You can't even copy that many terabytes in 72 hours. And so about 4 weeks later, 5 weeks later, we got a notice of payment hold, which was 100% payment hold with some very generic accusations, nothing real specific. We then requested an immediate informal conference resolution meeting, which we were granted. It was about a 2-hour meeting where we responded to these generic accusations. And immediately, just as a result of that 2-hour meeting, 75% of the lift was lifted. We then provided some financial information in a remaining 15%. So it took us down to a 10% hold. And one of the most frustrating parts about that whole process was, at this point, I'd already laid off 120 people. At this point, we already essentially closed down those 4 practices because of the effects of the payment hold. And I kind of wish that we had had this sit-down meeting before all of that had taken place, if it was simply a matter of talking through some things.
Thank you, Mr. Chairman.
Members?
Doc, you went from 100% payment hold to 10% payment hold, and you met with them for 2 hours? Is that what?
Correct, and provided some financial information. As far as I know, I'm the only provider that has had that kind of result.
And even despite that, you're still on the hook for $4 million? Is that accurate?
No.
Okay. So what do you owe any money according to the OIG right now to the state?
Yeah, so the calculation that I gave you was the $4 million was based on that specific program violation, not writing down what angle to hold the toothbrush at. That calculates into about $4 million. But they had other errors, other program violations that they had identified. So the total extrapolation was about $24 million.
What is the state of Texas saying right now that you owe?
Right now, we're actually in the process of talking through a settlement arrangement. That's currently what we're talking. But last I knew, it was at the $24 million mark. But like I say, we're in the process of talking through settlement considerations.
So there were some errors in the office, in your offices, or are you saying that you guys are complete victims and you didn't do anything wrong?
Were there errors? Of course.
Okay.
Of course, mistakes.
And I understand that, not
mistakes.
deliberate, but were there
right.
some that resulted in overbilling?
That resulted in overbilling?
Yes.
No.
Okay.
No, I would not say that they resulted in overbilling. Were there mistakes such as, like I say, documenting, writing down in the chart? For example, a patient came and saw you 4 or 5 times. And on 4 or 5 of those visits, everything's fine. But on one of those visits, you forgot to write down the blood pressure. That mistake right there is going to cost you hundreds of thousands of dollars.
Right. But that mistake that you're saying right there doesn't cost the taxpayer anything?
No.
Okay. So
Right.
is it your position that your offices didn't cost the taxpayers any additional dollars? It was just clerical errors?
Correct.
Okay.
Correct.
Thank you.
Members, any other questions? Thank you. Thank you, Doctor.